Doctors say 2 out of 10 hospitalized COVID-19 patients suffered from a cardiac injury.
When you look at other viral infections, your patients with severe respiratory viral infections who are admitted to the hospital, maybe around 1% of the time you'll see this type of cardiac injury, but with COVID-19, a much higher degree.
Experts say it puts athletes who train in high-end exercises like marathons or triathlons at greater risk for cardiac arrest.
So over the last several weeks, of course, there have been some high-profile cases of actually athletes being diagnosed with myocarditis. Now, to give a brief description of myocarditis, at its core, myocarditis is defined as inflammation of the heart muscle, and it's typically brought on by viral infections.
We have more virus here right now. We have done a poorer job controlling it, and that makes it harder. If we're able to bring sports back here in the U.S., it's going to be more difficult, more expensive, and more dangerous.
Doctors recommend athletes who are diagnosed with myocarditis to rest for 3 to 6 months with no high-yield physical training.
Based on the clinical presentation, the athlete would undergo a series of repeat testing, which would include imaging, exercise testing, Holter monitoring, looking at the heart rhythm, potentially other tests. And if all those tests are normal, then the athlete would be allowed back to return to play.
Doctors say the heart condition could also be a lifelong concern for athletes, but it's too soon to tell about the long-term implications. Reporting in Atlanta, Archit Seshadri, Atlanta Bureau Chief.